Since last year in the month of May to date, the community is still in camps. We have the flooding because it's at Budalangi where River Nzoia and River Yala join the lake, but at the same time we have backflow from the lake. So child protection issues keep on emerging. They are intense. Issues affecting adolescents and young people across the board, right from even the mothers being able to have a hospital delivery.
At Dhamira Moja CBO, we are based in Busia County, just at the border of Kenya and Uganda. Dhamira Moja was formed initially in 1999 as a result of the response to the El Nino floods. And then it was formed by a group of young men who had been taken to support Red Cross in responding to and evacuating the victims of floods in Budalangi.
So after that response, then these young men and women came to form a group for their what next.
When they came back, they were like, now what do we do? Do we go back and just sit in the community, or what do we do? Because during that time we had a lot of outbreak of HIV. And so they mobilized themselves and said they should continue working together as a youth group. Until 2020, we decided to move up, and we were incorporated into a community-based organization.
Dhamira Moja focuses mainly on key areas on issues of survival, where they support health programs. They also look at development, where they do intellectual development and psychological development of the adolescents within the community. There are key areas where they sensitize and guide the community across the county on various issues touching on child protection, from sexual abuse, physical abuse, psychological abuse, and any other related neglects and exploitation of children along the borders and along the areas affected by floods like Budalangi and Tesono.
We are the COP, the Community of Practice Anchor Organization. Community of Practice is an umbrella that is bringing together all stakeholders from the community to the national government, county government, the civil society, professionals, the private sector, other civil society organizations that are addressing different needs of the community.
For Dhamira Moja, it was an obvious choice for us to work with them in Busia. They have extensive structures at the community level, good networks, engagement with the county government, and also an alignment in terms of our value proposition and our both desired engagement at the community level.
Back in 2009, this was the first time Dhamira Moja got to interact with KCDF, and they were taken and given a project on education. So we have been implementing the education program with in partnership with KCDF since 2009 to date. So we can say that KCDF has been one of our longest donor partner that has been supporting us and facilitating most of our programs.
The major achievement we've had as Center for the Study of Adolescents, being members of the Communities of Practice, Busia chapter and Dhamira Moja, we've had the capacity strengthening.
We couple this program with training on local resource mobilization, and so that enhances their ability and it gives them skills to raise money locally, come up with initiatives that would help them to raise money. And it's not just money, it's all resources, including even human resource, in cash and kind contribution.
On issues of child participation, through Dhamira Moja, we have had partnership in schools and general community in engaging these children to make decisions on issues that pertains their life and their development. Specifically within the schools, we understand we have the child rights clubs.
The knowledge and skills we gained from the mobilizing support training, the local fundraising training, the ODSS training. We've improved our internal structures.
We were sensitized on Kenya Interagency Rapid Risk Assessment, that took 3 days, which is a key procedures and guidelines on how to identify issues that affect people who are affected by disaster risks. Specifically in Busia, we are affected with floods.
We are now part of the big advocacy team for Busia County, doing advocacy for different thematic areas.
Under health and wellness, we are focusing much on sexual reproductive health. That's the provision of dignity kits and menstrual health.
As an organization, we had to cascade the training down to the CBOs we are training. And the 4 CBOs in Budalangi that we are supporting now as Center for the Study of Adolescents were able to facilitate 500 children get school uniforms.
Those who are displaced or those who are affected by the floods, who lives at the camp, we are able to give them the dignity kits. That's for the women that are aged between 18 to 40 years with the mama kits. We also give around 150 for the girls kits, which comprises of the bath panties, petroleum jelly, a bath soap, and the sanitary pads. The 129 children between age of 0 to 3 years, we also give them total kits, which comprises of diapers of different sizes in partnership with KCDF.
We really have benefited as an organization because our reach has been widened.
KCDF is part of the Change the Game Academy Alliance, and the Change the Game Academy is really thinking around how do we ensure that there are resources towards community development. How do we ensure that communities are engaged from a resource point and from an advocacy point when it comes to changing the system around governance, changing the system around development.
We had a challenge as a COP engaging the duty bearers, especially when it comes to budget allocation.
When we are doing the mapping out, we were having quite unclear data that even the services we are providing, when you reach on the ground, because before you provide a service, you must request for resources. So you see, our budgeting and our estimates could not conform to what we are able to provide.
My name is Francis Namuju. I work for Community Empowerment and Development Center. This organization leads in the work of budget advocacy in Busia. Even before COP came to Busia, we had already taken root in training budget champions to understand the budget cycle. Then apart from just understanding the budget cycle, how they can participate in the budget making processes, and then helping them identify the budget calendar and the spaces of budget engagements.
Through COP, we have been able to be taken through budget advocacy trainings. We can't call ourselves budget champions because it's not a continuous process. You only have it periodically when the budget documents are out. And then you also outsource trainers, though we have budget champions within the county. So maybe I would recommend, as KCDF and Dhamira Moja, maybe we can make use of our locally available experts so that it is a sustainable effort. I will request KCDF to maybe avail more funds so that more organizations, because I think only 15 so far have undergone all these trainings on ODSS, on budget advocacy, and only a few have undergone LFR and MS. And we need to have all of us capacity built.
Dhamira, now that we have moved from our old office where we have been there for the last 10 years, and we have moved to a new office, but it's still the one that we have still rented. We would like to have our place-based, where we can also build some assets for sustainability. That one means we need more resources to help us have our own space.
KCDF, through Dhamira Moja, if we're able to get more resources to capacity build and equip these paraprofessional teams that are within the community, we are likely to achieve a lot in child protection, child care, and other issues surrounding children and other vulnerable groups in this community.
More resources for advocacy and implementation of the child protection and emergency guidelines will be a good thing for us as a COP.
Every day is a budget day, Every person is a budget person, and every shilling is worth a service.